So we have a very exciting panel. As a moderator, you always look at your panel, try to figure out how to run it. And in speaking to the ladies, it was amazing what they're doing. And I'm a big fan of doing things. And one of you, I think, said that their title is Get Shit Done, which is really great. I'm going to create a Get Shit Done officer in the company. GST. So there'll be a chief GST officer in SolveCare soon. But let me introduce an amazing panel of really accomplished women. Dr. Ann Ingram. She is a health informatics, social technology, CEO of Exponential Health Advisors. And I'll let her introduce herself because what she does on the ground is makes things happen. And her use of blockchain, I think you will find very compelling because we are here to actually make things work. So Dr. Ann Ingram, Anna, CEO of Adonal Consulting. Anna works with a very interesting population, the formerly incarcerated population, people who have been released from state or federal prison, and in coordinating their care post-release. And believe me, that is a complex care equation. So Anna's doing great work in that area, behavioral health and care continuity. So I'll have Anna introduce herself in a minute. Then we have Amber, who is a puzzle builder, which I love the term. And Amber is a technologist, works for Burst IQ, and reimagines the world and builds platforms that will help us reimagine the world. So I'll ask Amber to introduce herself, and then last but not the least, Maria. And what Maria is doing is enabling, through her alliance, 3D printed prosthetics to be delivered to people who need them. What a fantastic idea. And as a full disclosure, SolveCare started a charity many years ago with the idea of making custom prosthetics using 3D printing. And we didn't have people like her, so we didn't make as much traction as we hoped to. So I'm going to follow up with her after the panel. So let's start with you. Anne, would you please tell us a bit more about yourself and what you're doing?
Absolutely. Good morning, everyone. As he said, I'm Dr. Ann Ingraham. I'm the Chief Executive Officer of Exponential Health Tech Advisors. I'm a veteran, and so our organization is veteran-owned, CVE certified, as well as SBA woman-owned certified. Our team's experience is really deep in electronic medical record system implementation, one of the larger vendors. And so one of the things that we recognize, and when I did my dissertation, I did my study at the community-based, with community-based behavioral health organizations. And I recognize that there is a significant gap in digitization for community-based organizations to be able to afford technology to provide the care and services for the population they serve, which are very fragile individuals with significant barriers.
Thank you. And Anna, would you please introduce yourself? Sorry. Continue.
I'm Anna Brera, and I am the Chief Executive Officer of Adonai Counseling and Employment. We're out of Washington State. We serve, we have cases, do I have it?
Just closer to you.
Is that better?
Yeah, there you go. Perfect.
Our agency serves about 300 individuals a year. We work with Department of Corrections. We work with Department of Social and Health Services. Our services, even though we have case management within just the Puget Sound area, we actually cover most of the state of Washington in providing supportive, or getting folks connected to other supportive services. Our clients are not just individuals that are returning from corrections, but there are also individuals who are in transition, whether they're homeless or coming through domestic violence or coming through where they've come from some kind of life traumatic disaster in their life and now having to begin again. So I'm really excited to be able to be here and to talk in regards to the blockchain. One of the biggest issues we have is being able to have a continuity of care for the individuals we have as they move from one agency to another. So I'm excited to kind of see what we're able to share with you guys today.
Thank you, Anna. Amber, our puzzle builder.
Oh, thank you. I'm Amber Hartley. I'm the Chief Strategy Officer at Burst IQ. We build life graphs, and I'll tell you a little bit of background of our founder and how the company came to be, as well as sort of a combination of that and my background, because it all kind of comes together. Really, Burst IQ was founded by cybersecurity experts who have been in this business for a very long time, been working with the fundamentals of blockchain before it was called blockchain, and really understood that there is this need for all of these intelligence systems, all of these applications and services and enterprise solutions that need to understand people at a much, much deeper level. And how do you do that in a way that respects someone's personal sovereignty and the ownership of their data and respects them as a person and their rights as a person? And so fundamentally, we set out to solve this challenge of how do you capture all of the data that all of these intelligence systems need? How do you make that owned and trusted and really fundamentally person-centric? And then how do you make it available to all of the AI systems and intelligence systems that need to get access to that data? And that's really what the company set out to do. I found out about the company about a year after it was founded because I was running the Innovation Center at Catholic Health Initiatives, which is now Common Spirit, which is one of the big health systems in the US, and found that we had so many applications and services and these really cool inventors coming to us and saying, I have this super awesome app, and it's gonna let all your patients monitor their glucose and their weight and their heart rate and their blood pressure and all this cool stuff, and you can give all that data to the doctor, and then the doctor is gonna be able to do all sorts of cool things with it. And we fundamentally said in the Innovation Center, like, you clearly have no idea how a health system actually works. Because a doctor has 15 minutes, literally 15 minutes, and that's it. They're never gonna look at all of this data. So I came from the perspective of, how do you take all of the cool, amazing data that's out there in all these apps and services and all these digital solutions, and how do you distill that down into the soundbite that a doctor actually needs in the moment that they can actually do something with, because they're never gonna look at all of that data. So how do you contextualize that data and wrap trust around that data and then make that data available in a way that really delivers insights to the people or the AI systems that actually need it? So I came from that perspective, and I saw Burst IQ, or Frank speaking about Burst IQ about a year after the company was founded, and I said, holy blankety blank, you're doing it. I really, really want to help you. And so that's where we came to be. So we build life graphs. They are digital fingerprints of a person across all the different life, health, work experiences that a person has over the course of their journey. Brings that together into a unified picture of a person with ownership and consent and governance of that data, and then makes that available with person's consent to all of the AI systems and intelligence systems that need it.
Thank you. Very impressive, and a lot of value in that. I'm sure we'll hear about that. Maria, would you introduce yourself, please?
Hello, my name is Maria Esquela. I am the president of Enable Alliance. It is a 501c3 that was founded in Baltimore. We serve a global community of crowdsourcing humanitarians. 10 years ago this year, there was a person who had, in South Africa, as an artisan, accidentally cut off some of his fingers. He was looking for a way to make his own prosthetic because they're often not covered by insurance. He found a puppet maker and props maker in Washington State and invited him on Thanksgiving to come to his home and his workshop and help him make fingers for himself. There was a little boy, 4 years old, who had been going to camp for children who were born with limb differences, and when he saw what they were making, he asked if he could help so that he could make a hand for himself and then for one of his friends. And so that is how we got started. So when you're celebrating service on Thanksgiving, remember us, because out of the garages and the pain points of people who are normally left out. You have people who are collaborative innovators, who are able to learn technology. They're given access to emerging technology for a crowd that might be a team bigger than they can see. And they are able to utilize the pain rather than waste it to give feedback to experts in medicine and in engineering and craftsmaking in order to make what are considered by the FDA Class 1 medical devices with exceptions. And this is shared open source through a global community on many repositories, from Thingiverse to the NIH 3D Print Exchange, where we manage the prosthetics and assistive devices collection. If there's anybody looking for an internship, please see me afterward, because that would be a phenomenal thing to be involved in. I was, at the time that I got involved in this, in charge of medical education for the neurosciences at Johns Hopkins Medical Institutions. And one of my fellows was upset that we had spent so much money on EMG equipment because he could replicate his experiments with about $25 worth of Arduino equipment. So we sat down with the neuroscientist, my daughter, at the time in the 6th grade, and me, and we were able to record the signals from the nerves, play them back from my phone, an Android phone and an iPad, and then use them to transfer the signal from my daughter's arm to mine, so that every time she closed her hand, my hand shot. And then we started looking for something to animate, and that's how we discovered this community that was making prosthetics and was just beginning to learn how to, instead of making them from erector sets and melted plastic, how to use 3D printers to do that. And so we made the first instructions and the first tests and things. So now we're making exoskeletons, hands and arms that are body powered that you can try on in the other room and bid on, please, during the auction. We're making powered devices, myoelectric devices that would pick up on the signals of the nerves in order to open and shut. That's functional prosthetics that cost less than, anywhere from $12.50 to $150,000. I mean, to $150 compared to the arms that some of our experts are working on, the most expensive prosthetics in the world that my kids get to help train computers to use are $151,000 arms. So this is an affordable, accessible method for doing that, and it creates a pathway for other open source medical supply. So you'll see on the table the tourniquets that were innovated for Gaza that we're making now with Maker Hub in Kiev, because there's a desperate need for that. There's a desperate need in Africa for medical supply for midwives who are really poorly equipped. You can make this, send it into the field, and not worry about it coming back and contaminating your clinic. They can burn it in place. These are all things that people need access to, and they're ways that in a third space that underserved people can get access to workforce skills and education and be part of disaster response, recovery, the resilience of themselves and their community. So I'm really thrilled to be working with parts of my community, answer to every part of the community that they're working with, and from a very local level to a global NGO level.
Thank you, Maria. Very impressive. As you can see, they're actually solving problems that truly matter to people. And technology is a factor, but technology is not why people are served. It's just an enabler. And I'm going to talk, let's start with you. What exactly do you see, and what are you doing with blockchain, and what problem are you solving? So tell me about the problem statement, and tell me about your experience in trying to solve the problem.
So one of the biggest problems...
Microphone.
We need a microphone,
Sorry.
yeah.
One of the biggest problems, I'm used to having a really loud voice, so I don't want to hurt your ears. One of the biggest problems that we find is a lot of the folks that we serve are coming in places of transition, whether they're coming out of corrections where they've been gone. I have a gentleman that just got out today. He's been gone since he was 17 years old. He's now 46. Coming back and having to restart their life again, pulling the documentation and the things that we need to be able to put up supportive services for them. If there's someone that's been homeless and someone who hasn't had the documentation, had to move from transition to transition, whether they've come from, California, now they're up here, they're sleeping in a tent, they don't have their birth certificates, they don't have the documentation needed to really be able to access some of those community services. The other problem we have is that once you come and get those services, because they're so far in transition, trying to keep up with that documentation, being able to have it at real time when we need to be able to make a referral to another agency. If I have an individual that's coming in with a disability and I've got to send them over to Division of Vocational Rehab, we have to wait 6 to 8 weeks to be able to capture all that documentation that we need in order to put a good support plan together. One of the things that we're seeing, especially, and we're really excited with looking at the blockchain, using Axion Galaxy, is being able to have that information, have it captured. And our hope is, through this, as a solution to what we're looking at, is being able to use our partnering contractors, whether it's, other government agencies, local agencies, and other community-based providers like our partner with Fresh Start here, is being able to have that information where when we make a referral over to them, we're not waiting weeks and months for someone to be able to help them with the crisis that are in right now, to be able to have the documentation they need to be able to move them forward. The other thing that is really important for us is through the blockchain, having a secured system, whether we can have it on their wallets or whatever, however that information is stored, that they'll be able to have the control of what's going on in their life at their hands. For many of the individuals that we have, they don't have control. They've lost control. They've lost themselves in systems. This now allows them to have it. If information's going to be sold for data or whatever that issue is, they get that to be able to decide where that data is going to go, who's it going to go to. So, yes, I hope that answers your question.
Thank you, very well articulated. Dr. Ingram, you're doing something similar but different. Educate
Very
us.
similar. Actually, Adonai Counseling and Employment, and Anna being the CEO, and Fresh Start Professional Services, we have Franklin Smith as the Chief Compliance and Contracts Officer, and Terrence Morgan as the CEO of Fresh Start. They serve the same population, and they are our pilot site. So the technology that we provide in partnership with Burst IQ enables these leaders to provide the care to the population we're talking about.
Can you give a specific example of how that technology is working in the real world?
Absolutely. So as you know, with technology adoption, there are stages in it. So if you think about the community-based organizations, as I mentioned, there is a gap in digitization. There are also barriers because of funding to adopt technology. So that adoption didn't happen in 2009 with the HITECH Act and ARA. Funding was not provided to these organizations. And I'm going around just to kind of get to the point that you asked, and the question you asked me about, because I think I need to lay a little bit of contextual understanding as to why there's an issue and why we're doing what we're doing in stages. So we built a case, I'll call it a case management software on Burst IQ's LifeGraph blockchain network, HIPAA compliant network. So right now with our version 1.0.0, we've taken already, transformation is happening within these organizations, taking them from paper to a digitized version of documentation for their clients and a digitized version of referral management. So that is what we're doing right now. That whole change management, right, organizational change management is happening right now. We heard about people, process, technology. In addition to providing the front-end solution for them, we're also working with them on that organizational change management for adoption. So what they're doing right now is, as an example, if there is a client who's referred from the Department of Correction, as an example, and the case manager within the organization makes the initial contact with that individual coming out of incarceration, as an example, they have a functionality where they can quick register that individual in the solution, Axion Galaxy 360, and also send a link to that individual for that individual to complete the intake form before they come in to the organization. All of the data that's being entered in the software is stored on chain. And at the end of the day, we will be able to capture not only information on their behavioral health, which means mental health information, data, as well as substance use data, as well as data related to the social determinants of health, which is education, transportation, food. Also, we will be integrating with other systems so we can also capture their physical health, and we also have plans to build in a way for more clinical physical health documentation. But that's not the real treasure. For me, the real treasure is really to be able to combine all of that data, the physical health data, the behavioral health data, the social determinants of health data, as well as the criminogenic risk and assessment and needs data. And then to be able to give the big picture to that individual making a decision for the person they're serving and leveraging the functionality of the life graph that Burst IQ platform allows us to do. And be able to, again, do more analytics. It's about data, it's about making empirical decision-making contextually so that you're not getting siloed bits and pieces of information, but can look at the whole person and the data associated with that person to make the right decisions, especially for the population that these leaders, and Maria, yourself, you're so integrated within this whole sphere, have to make for an individual without a lot of bias and without making decisions in silos.
So Amber, to you, since you are the platform, how does the platform enable this? I mean, the idea of a patient-centric record has been around since the patient's been around, and we've always talked about that. I think I started hearing that when I was 18 and entered healthcare as an intern, and I remember we had the same conversations then. So what exactly does today's technology set, blockchain and otherwise, do to make that happen?
Yeah, so that's a good question. I think one thing that's sort of important to consider about blockchain in general, sort of stepping back from kind of Burst IQ and LifeGraph in particular, is that we were having a conversation about this earlier this morning, that you can use blockchain to do the exact same things that you do today. And if it's not implemented correctly, you're not engendering trust, you're not making data more accessible, you're not empowering a person. You can do all of that and use a blockchain and talk about having a blockchain-enabled solution. But that doesn't really actually help anyone. It doesn't really move the needle, and it doesn't push us towards this Web3 world that we know is coming, where data is distributed, trust is distributed, power is distributed, control is distributed, and intelligence is distributed. And so fundamentally, we felt that it was really important to understand how the methodologies and the technology and the philosophy of blockchain can be applied differently. And so that's really what we set out to do. How do you use that technology to really empower people and really provide people with a mechanism to understand themselves for the systems that they interact with and that they want value from, to understand them better. And that's kind of fundamentally what we do. So we can go into sort of like the deep technology of kind of how LifeGraph actually works. It would probably take an hour. But I think what's really sort of important about what we do and kind of why we are so excited about the work that Adonai is doing and that EHT is doing is that fundamentally there's kind of some core pieces. The first is that being able to actually capture the right data and make that data available to the various different endpoint systems that all have to be connected with each other. You sort of have to remember that, like, we're working in an industry where the systems that you're working with already have established applications and endpoints that they use. And you don't want to go into any existing system and say, yeah, that's cool, but rip it all out because we've got something better. Because everybody's going to tell you to go pound sand. So if you can come in and say, your existing systems will still exist, but we can make them better. We can make them more effective. And we can allow you to do things with data that you wouldn't normally be able to do. We can allow you to access data and use it in a new way so that you can do what you do better. And that's really the goal, right? So that's one piece, is how do you bring all that data together so that everyone is tracking on the same line, understanding what we have to do to support this person. The second piece that I think is really important is that the intelligence layer of that, to understand what will actually help this person, what kinds of services and interventions will be most effective for this individual person who is different from every other person in the world, right? They have their unique life, their unique circumstances, their unique behaviors. How do you take all of that into account to understand a person at a deeper level so that you can serve them better? And the last thing that I think is really powerful about this is that you guys are fundamentally working with a population of people who have had everything taken away from them. And if you can think of a group of people who have been more disempowered and really had all of their autonomy and their sovereignty and their power stripped away in going through the justice system. And to be able to provide them with a mechanism to start capturing that back, to start seeing what it means to be empowered and to have some semblance of control over your own life and your own information and your own data and your own journey. That is incredibly powerful, to be able to start giving people that back. And it sets them on a path that they didn't even know was possible. And I think that is one of the most powerful things about what you guys are doing for people impacted by the justice system. And it's so in line with what we want to do vision-wise. So I think, those sort of three pillars are just really powerful.
Thank you. Maria, are you using blockchain or any such ledger technology in your business, in
Absolutely.
your effort, and what do you do with it?
So initially, because we're a global community, we have varied communities of practice. So there are people who see themselves as very decentralized and they're helping people in a local way. The next hand is better than the last because of the feedback they get directly from the last person they helped. And then there are other groups that are truly functioning as highly efficient, distributed systems that are making open source medical supply during COVID and are responding to disasters like the Ukraine. So initially, we found that we needed to make sure that every device that was made was given away for free. And so we had to defend intellectual property that was shared open source by using Algorand. We selected that blockchain because it had a negative carbon footprint and because they were so eager to teach and assist during the Boston Blockchain Hackathon in 2018. And I was very proud of my team of students for coming in second and being able to rewrite their stars, not only in utilizing devices to learn programming, to teach it to other people, but then also being able to pursue what they really wanted to do, because none of them really had set out to be programmers. They really set out to accomplish other things, like learning how to game or learning how to operate drones when they were able to 3D print adaptations to it. We're utilizing blockchain to teach people in stress the digital literacy skills they need to create an identity when they don't have one. In Africa, women are born and they might not even get birth certificates. I don't even know if you can understand how you can be a non-person in your own family, in your own country. If you were born with a disability like a limb difference, there are people I've talked to that have been told that they are a tatter of a human being. And so if you're going to pick up a child and run, that might not be the child that you pick up. It's a devastating thing to address limb differences, and it's a devastating thing to address the inability to pursue your passions in education in some areas of the world. And so giving people an identity that allows them anonymity, a fair playing ground for an e-market where they can have a gig economy, a way to move resources and funds that are portable without being exposed to violence because you pick something up somewhere and have to walk across a field alone to get back to your family. UN trainees are often raped in the fields and robbed on the way home. And the accounting that we have in some of these UN meetings is so devastating that even the people on the dais need to take a break for a minute and just regroup themselves. I want you to see these health problems and the volunteers and the trained people getting paid as all vulnerable population, and to utilize crypto and every aspect of blockchain technology in order to not only share information in a distributed fashion so it can't be erased regionally, to look at the ways people can own their own health information in a portable way, and that their everyday lives are their health, their everyday lives, their access to nutrition, their access to employment, their access to their credibility as certified people. We can use the training that we give and these digital certificates to say, I don't know who you are, and I don't know what training you've had in the past, and I can't see the diploma you say is buried in your garden. But I can say that you function like an engineer with 15 years experience. Or I can say you function like a high school student that knows how to operate and calibrate a 3D printer. And the MSF is going to pay you in the refugee camp to make umbilical cord clips and IV bag clips and tourniquets and microscopes that don't even need supports. It's an easy print for a high school student to build a microscope that's lab quality. And for them to get paid for that and to utilize the emergency workers' water bottles as filament, those kinds of things have an impact on the environment that also are things that you can give people a wallet and pay people for while they're harvesting plastic instead of dangerous food off of contaminated waterways. They've done that during, our group has done that during the International Coastal Cleanup in the Philippines. The people got paid on the beaches before they even left. And the digital badges were all evidence-based, so they could become valued supply chain partners in the future. These are ways that people can assert their, environmental and health justice.
Absolutely. I think if one fundamental value we all seek to achieve through blockchain is empowering the individual. You're giving them, whether it's dignity or autonomy or sovereignty, but I think options that they don't otherwise would not have. Anna, let me come to you in wrapping up this panel. What are the insights you can share with us? What have you learned? Surprises? Oh my God, why didn't I think of this? What lessons do you have from this?
Well, I think the biggest insight.
Microphone.
I think the biggest insight is the ability for, one of the hardest barriers for someone is having to rebuild their life, not being able to have the information and the things they need to be able to move on. I've been established, but even right now I'm born in Costa Rica. I had a house fire and lost my birth certificate. I was born 50 years ago, minus 25. But because I was born back then, the way they kept the records here, right here in DC, because my mom had to file paperwork for me born abroad, I'm having a hard time getting my birth certificate. Imagine someone who wasn't born abroad, just someone who's lived in transition, not being able to access the things they need, the resources to be able to do that. Having someone that walks out of an institution, one of the things we find that's really hard for them is, when they're coming out and we have to go get their driver's license, but they've not had any paperwork around. Their mom's gone. They've been locked. They've been gone for 30, 40 years. Now, how do I access that information? Oh my gosh, the school closed that had my documentation that was there. How do I be able to access that? When you are facing barriers like that, you already faced the barrier that you're walking around with this tag on your back that says, I'm a felon. I have conviction history. Now we're talking about, I got to go and figure out how I'm going to go and just access who I am. Why try? Let me just go back to doing what I know best. And that means let me just get a hold of somebody on the corner, sell my rock, and, get ready to go back to the institution where at least I know I have a safe existence, that I'm DOC number 76502. And I think for us, I'm excited at the opportunity to have the blockchain, to have something that we can hand back to them, that they can say, I am this. This is what I have accomplished. Forget all the other stuff. I have this. And I think And so if I can share anything at all, it is that as you have people like that that are going to come across your path, is making sure that you're giving them the ability to do just that. Giving them the ability as they come through to see you, that you're giving them the documentation, the things that they can have that can say, I am this person. I'm not the convict. I'm the individual that has, that lived, that went to school. By the way, did you know I had a 4-point grade average while I was in school? I just got messed up when I was 20. But you know what? I messed up big, and I've been gone 40 years. Now I'm trying to reestablish myself. Having the ability to be able to do that can truly take a person and change, literally change the foundation, giving them true self-determination and becoming, one of our community members.
Powerful. Dr. Ingram, what insights, what aha moments have you encountered?
There are a couple of levels, I think, of insights. There is the insight of what technology is meant to do for the individuals who are using it. Technology is really not the driver. The operations is the driver, whether it's clinical or social, the work being done. Technology is the enabler. And so the insight that I have, and I would share with you, is that understand the people who you're building technology for. The why. Why am I putting these widgets together? Why am I putting this code together? Who is it going to impact at the end of the day? The next layer of insight that I have is around the adoption and technology adoption. As we're building technology, we need to ensure that we're working with the end users to be able to adopt that. And being I don't know if I'm an academic or not, but I am, okay. Going back to some core fundamentals, we think about some of the theories and framework that makes adoption of technology successful. I would call you to take a look at theoretical frameworks and models like the Technology Adoption Model, TAM, core. Technology needs to be usable and have ease of use, which will drive the behavioral decision and behavioral intent to use the technology. If we're not stepping back and at least thinking about that core basic gold standard, also take another look at Rogers' diffusion of innovation theory. How do you get the information out and diffuse it out over time? Think about the adoption curve, the innovators, the early adopters, the early majority, and then, of course, everybody else, the laggards. So I think that we really need to be very critical in our thinking as we're strategizing on using and rolling out technology or building technology. It has to serve a purpose, and at the end of the day, there's an individual at the end of that stream that the technology will impact. But first, you've got to have people adopting it to use it. Otherwise, we failed.
Amber, what insights and lessons can you share with us?
I don't know if I really want to follow that.
It's
That's
a tough
probably
fact.
what I would have said. Yeah, I think that was kind of a mic drop. Yeah.
All right. Well, Maria, please go ahead.
So my aha moment is this conference, for which I'm grateful to the organizers of the GBA. I think you have to lift your eyes up. You have to, first of all, realize that the blockchain maturity model applies to all of us in what we're doing and what we want to do in the future. Learn it now and integrate. If you haven't already joined an interest group that shares your common ground, do it. If you haven't joined a working group that is working on a problem that benefits all of the GBA, this is your moment, especially if you're not in crisis. There are groups here that are working in crisis. I don't know how Eugene sleeps, and props to you for all that you take on. But they're using other people's human crises and their very technical skills to collaborate across working groups to create solutions that are more than just proof of concept. They're saving lives, they're saving cultures, and they're making it possible for us to have these discussions about how we want to use this in healthcare. And then the action groups, where we're looking a little farther. I've talked to Tara, Sue, and Ross about the Government Blockchain Association Foundation and its nonprofit work. But please, by all means, get involved in what this GBA is doing, because this is creating the future that we want to live in. This is creating the smart city infrastructure where we're going to be operating. And we better be a part of creating the foundation for it, because we're going to repeat the mistakes of disenfranchising people. North Carolina, my incarcerated returning citizens aren't allowed to get an education on educational campuses. They're restricted away from that, and we're working around that. There are ways that we can prevent these problems, these pain points, from being repeated in the future, but we have to work together now and leverage what we know now in order to do that, and it will affect our health and the livability of our planet if we do that. So that's my aha.
Great. Please give a big hand of applause to the ladies. And I encourage you to reach out to them and speak with them. There is a lot more they have to share with you than, of course, we have time for. And I want to thank the GBA for bringing such a panel together. I've had the opportunity to moderate a lot of panels, but it's always the panelists that make everything happen, and these guys are amazing. So again, a big hand of applause, and thank you.